Good afternoon, everybody. The Lieutenant Governor and I, and where's the Mayor? Shaking hands? He hasn't gotten it yet?
I can't leave the mayor behind.
Is it okay if we start without him? Okay. The mayor is getting his shot right now. And we're glad to be here to get our booster shots at the Shaw Center in Brockton. Getting a booster is free and is available at over 1,000 locations around the Commonwealth. This location is one of our administration's state-sponsored high-volume COVID booster sites. It's one of several high-volume sites across the Commonwealth, part of that network of over 1,000 locations where people over the age of 18 can get their booster shots. They're 6 months out on Pfizer and Moderna from their original series, or if they're 2 months out on J&J. The Shaw Center has actually been a very important part of our activity associated with the pandemic here in Brockton. First in the initial vaccine rollout, and now as a high vaccine booster site. We visited the Shaw Center back in March when we were in the middle of our vaccine distribution timeline. And at that time, Massachusetts still had significant COVID-related restrictions for businesses and in some cases for large groups. And we were racing at that time to get our residents vaccinated so that we could all get back to something close to normal. Back then, obviously, vaccine supply was a challenge, and we were still focusing at that point on vaccinating higher risk populations, such as older adults. The last time we were standing here, we were finally able to announce a schedule for everyone to get their shots by the middle of April. We've come a long way, obviously, since that time. Vaccines have allowed us to reopen our economy and, just as importantly, to make sure our kids are able to go to school on an in-person basis. And last week, families were able to spend a normal Thanksgiving together because of the presence of vaccines here in Massachusetts. We've led the country in vaccinations for months, and as of this week, New England is outperforming the rest of the country in terms of the number of folks and the percentage of the population that are fully vaccinated, and we sit just a little bit behind New Hampshire in terms of the percentage of our population that's had at least one dose. We're also a national leader in ensuring equity in our vaccination programs, especially because of sites like this one. A report last month by the Kaiser Family Foundation showed that Massachusetts leads all states in terms of the percentage of our black population that's been vaccinated. Over 70% of our entire population is fully vaccinated, and for many of those residents, it's now time to get a booster shot to provide added protection against COVID. Massachusetts, over 1.1 million booster doses have already been administered, but we know there are many more to be delivered. Fortunately, they are widely available across the Commonwealth, and we're not facing any of the supply challenges we had back in March. Anyone age 18 or older, I'll repeat this again, who's 6 months out from their second dose of Pfizer or Moderna, or 2 months out from a single dose of J&J, is eligible to get boosted. If you meet that criteria, you really should get a booster shot. It's the best way to ensure as much protection as possible for you, your friends, your family, your coworkers, and your neighbors as you possibly can against COVID-19. Boosters in Massachusetts, as I said before, are free and widely available, and there are over 1,000 locations across the Commonwealth where you can get one of these shots. These sites include retail pharmacies, regional collaboratives similar to the ones that we ran when we were vaccinating people for the first time, that are run by local health departments, community health centers, doctors' offices, and many other settings. And you can visit vaxfinder.gov.mass.gov to find a booster location that's near you. There are many appointments available every day, and demand for boosters has picked up in the past few weeks, which we think is a really good thing. So if there is an appointment immediately available at your nearest location, it may take a few tries, or you might have to push out that appointment for a week or two to get it scheduled. This is a fairly recent phenomenon. Unlike this past spring when there was a lot of availability for this, we now have a situation where we have a lot of people who are out getting vaccinated and getting boosted, and we think that's great. There are no supply issues associated with this at this point in time, and we're working with a wide range of partners to expand our existing capacity to administer these shots across the Commonwealth. This site here in Brockton, as I said before, is a high booster location, and it's been open like many others across the state, and they're there to augment the existing network of pharmacies and healthcare providers that have been doing this throughout the course of 2021. We're also going to be opening some additional high-volume sites later this month. In total, our state-sponsored high-volume booster locations have the capacity to do about 3,500 shots a day, and that number will continue to increase as more locations are added. Lieutenant Governor and I had a long conversation this morning with our colleagues in municipal government, and I fully expect, based on what we heard during the feedback there, that we'll see many additional sites open across the Commonwealth over the course of the next several weeks. Across the state, the network of vaccination sites we do have is administering about 50,000 shots a day between first, second doses, and boosters. We're also working, as I said before, with our colleagues in local government to expand existing booster clinics around Massachusetts. Since the beginning of this booster process, we've been communicating with our partners in municipal government to encourage local boards of health to run more clinics and to make it easier for people to get access to a booster in their community. And we fully expect that that will continue to move forward in the weeks ahead. We've been enormously successful at vaccinating our residents. The process has allowed us, in many respects, to manage the pandemic and to keep our schools open since the start of the school year. And I do want to say on behalf of both the Lieutenant Governor, myself, and everybody who's part of our administration, how much we appreciate the work and the effort that the folks who operate these clinics have put into making them available to people in their communities. And I also have to give a big high five to the people of Massachusetts for once again stepping up and coming out and doing what we believe is the best thing they can do for themselves, their families, their neighbors, and their coworkers, and that's get the shots. As the weather gets colder and as people continue to spend more time indoors, we know we'll continue to see more cases of COVID here in Massachusetts. But the science on this one's clear. The vaccines do help keep people from getting very sick from this virus, and the boosters provide an extra layer of protection that will be especially important as we head into the winter months. The federal government outlined several proposals that they'll be pursuing yesterday, many of which will involve additional focus on boosters for all adults across the country, and the CDC's updated guidance now recommends the same thing our guidance does, which is that everyone over 18 who's eligible should get a booster shot. Have I said this one enough times? What do you think? It's easy to go online at vaxfinder.mass.gov to find an appointment, and as I said before, it may take a little while to find an appointment nearest to you. The final thing I just want to say is how important these booster shots are and how important the vaccine is. If you take a look at the data that we publish on the state's website with respect to COVID hospitalizations, I'll say two things. The first is, if you were to actually take the number of people who are vaccinated and the number of people who are unvaccinated and look at their representation in the number of COVID hospitalizations that we produce every single day, and you assumed that all the folks who were unvaccinated got vaccinated, and everybody's data with respect to what share of that was represented in the number of hospitalizations related to COVID, the COVID hospitalization rate would drop by about 50%. Let me just say that again. If you take the COVID vaccinated population and the COVID non-vaccinated population in total, and you take a look at how much of that population is spending time in the hospital with COVID, each of them, if all the folks who are unvaccinated got vaccinated, it would drop our hospitalization rate by 50%. The vaccines clearly make a difference, and we think it's really important for folks, if you haven't gotten vaccinated, to get vaccinated, and if you're eligible for a booster, get a booster. It's the best thing you can do for yourself, your friends, your families, and your neighbors. Thanks. With that, I'll turn it over to Lieutenant Governor. Thanks, Bob.
Well, thank you, Governor. And it's good to be back here in Brockton at the Shaw Center. Before introducing the mayor to say a few words, we're both glad to be here today to get our booster shots. And we're taking the opportunity, as you've heard from the governor, to encourage all those over 18 to do the same. Any adult who is at least 6 months out from their second dose of Pfizer or Moderna, or at least 2 months out from their second dose of J&J, is eligible. The CDC recommends boosters for all adults who meet that criteria. Our administration has worked in partnership with healthcare providers, local municipalities, and others to make sure boosters are widely available for residents all across our Commonwealth. They're available at 1,000 locations. These include retail pharmacies such as CVS and Walgreens, regional collaboratives sponsored by our local boards of health, hospitals, community health centers, primary care offices, urgent care centers, and state-supported mobile sites. This morning, we did get a chance to talk with our local officials, as we had done over the course of the last 22 months, and asked for their support and help in expanding site locations in their communities. And we encourage those communities who have not yet launched clinics to do so. The federal government has assured us that supply is not an issue. Boosters are available for everyone who wants one. We hope to continue to work with more cities and towns, obviously, to make more boosters available. And as we head into the winter months, getting your booster will be the most effective way to ensure maximum protection from COVID-19. This will help us keep our schools open, our economy moving, and let our families enjoy the holidays together. So please, as you've heard us say, get a booster shot and help yourself, your family, your community, and your friends.